physicians don't want to spend 15 minutes with a patient. Like, they don't want to have to see 60 people in one day. That's crazy. And people don't want to be seen in 15 minutes.
I don't know how anything meaningful can happen in 15 minutes. Like, you can hardly take somebody's blood pressure and their vitals in 15 minutes. All right, welcome back to the Alternative Flight Plan podcast. This is where we challenge the status quo in healthcare and explore what else is possible. Because when it comes to chronic illness, the standard approach doesn't always navigate you where you need to go. Today's guest is Dr. Jenny Bennett, a naturopathic doctor and acupuncturist at Aria Integrative Medicine in Seattle, Washington. She specializes in autoimmune conditions with a particular focus on rheumatology. In addition to her clinical work, she teaches rheumatology at Bastyr University and collaborates across both conventional and alternative medical communities to expand options for patients navigating chronic illness. So, without further ado, let's taxi to the catapult and get this aircraft airborne. All right, Jenny, welcome to the show. I'm glad to have you.
I am stoked to be here.
So, in a way of a little bit of background, I have known Dr. Bennett for quite some time. She did our rheumatology class at Bastyr University when I was getting my medical education. And I also did recently, in the past year, her autoimmune mentorship, which I found very valuable. There's a lot of autoimmune stuff out there, and the more we hear about COVID and viruses, and the more we learn about the immune system, we hear autoimmune conditions coming up more and more. So I thought it appropriate to have Jenny on so we can talk a little bit about the overlap between conventional and alternative when it comes to autoimmune diseases. So do you have anything to start with, or you want me to just jump right in?
You know what? Let's just jump right in. I'm ready.
Okay. I guess I should also tell the audience, if you don't like 4-letter words, this might not be the podcast for you. I love swearing, and so does Jenny. So you might hear a few words, and I definitely welcome that. So let's start with helping people understand what is autoimmunity. I mean, that's a huge category of stuff. So when you have somebody come to your clinic, how do you talk to them about that?
Yeah, I mean, so autoimmunity, just in its basic sense, is our immune system, which is our basic defenses against all things external invasion. And it's supposed to protect us from those external invaders, but sometimes things don't always work the way they're supposed to, and our immune system can actually attack our own body for a number of reasons. And in essence, that's an autoimmune disease. And this kind of definition is sort of has been evolving over the years as we understand autoimmune diseases a little bit better. But there are many ways by which an autoimmune disease can occur. But in general, it is our body essentially attacking itself or causing damage to itself when it's not supposed to be doing it.
That seems like an odd thing for the immune system to do. And there's a lot of different ways that can manifest. And some of the obvious ones that we talk about are, like, almost everybody in my practice seems to have low thyroid, including men these days, and we can get into the different populations that seem to present with more of a certain type of autoimmune. But traditionally, I've noticed that women have a lot of thyroid issues. But it can be the nervous system, like multiple sclerosis. It can be the skin. It can be any number of things. What is it about a patient's experience that causes them to come see you as opposed to a conventional provider?
Yeah. Well, autoimmune diseases as a whole are extremely complicated, and some of them are very easy and straightforward to diagnose, and some of them are really challenging to diagnose because we think that we wish that we could just have a set of labs, and ordering those set of labs would tell us that someone has an autoimmune disease, or doing imaging would just automatically tell us that someone has an autoimmune disease. But that's not true a majority of the time. In fact, I don't know, more than 50% of autoimmune diseases have absolutely no positive labs or imaging markers at all. And so, the internet, while it's a wealth of knowledge for individuals, I think a lot of people will go into their providers saying, "Oh, something's wrong. I'm not feeling very good." And the providers, will do what they basically do, which is like run labs, look at symptoms, things like that. But if there's not something glaringly obvious, then people who are especially in the beginning stages of autoimmune diseases kind of get left in this weird gray zone where they're not feeling like they're okay, but they don't have a clear or straightforward path of getting a diagnosis or getting treatment for it. And then they go to the internet and they're like, well, it looks like it's autoimmune. And so a lot of those people end up in my office. Um, or if they're like, well, this very much looks like something that might not come up positive on labs, but don't have anyone that will listen to me or help explain to me what's going on with my body. Like that is the most common population I will see often, which I think is a big portion of it. I don't know. Those are the people I see. So it feels like a big portion of it.
Um, I I think that one of the most important things you mentioned is that people are coming to see us because nobody's really listening or they don't know. And so they say, "Well, I don't know what's going on with you, so I can't help you." I think the way I find autoimmune diseases in my population is when we're talking about a series of symptoms and I zoom out and say, "Has anybody ever done this or asked this?" And a lot of times people are like, "Nobody's ever checked my thyroid." Well, you're 52 and you have all kinds of strange symptoms. Why hasn't anybody done that? It's a little bit frustrating from um, a medical standpoint to have somebody who knows there's something wrong and nobody's dived in deeper.
Yeah. And I mean, I think people are fairly in tune with their bodies. Like they know something is off. And inflammatory symptoms in general tend to have kind of a not a basic pattern, but there are a lot of characteristics that are like, oh, that looks inflammatory. That looks like it might be immune mediated to a certain degree. Um, and I think you're spot on. It's like a lot of providers don't know a lot about autoimmune diseases. And so when you walk into someone's office and they're like, I don't know anything about rheumatoid arthritis or lupus or, psoriatic arthritis or Hashimoto's or whatever it is, um, they they don't wanna treat it because they don't feel comfortable in diagnosing and making that assessment, and unless they know how to make a referral, it's just a lot of people get left behind.
Testing is an interesting thing. I do have a lot of patients who come in because they see my website that I that I offer all kinds of eclectic testing. Eclectic meaning something other than your basic annual blood markers, blood panel or like a lipid panel, um, and and they want testing because their conventional provider won't set them up with it. And I think it goes back to what you just said, where the conventional provider may not even know that this stuff is out there. At the same time, I hear the criticisms of a lot of providers who say naturopaths test too much. What are your thoughts on that?
Yeah, um, I don't know, I think any provider tests too much. Like, I've seen MDs test tons of labs they don't necessarily need to test for, and I'm like, "Why are you doing that?" I think that I wouldn't say that NDs in particular test too much. I think we're thorough. And I know a lot of NDs, even when they do lots of tests, are taking lots of things into consideration because we're looking at all of different types of things. Like if someone goes into like a rheumatologist is not going to check someone's thyroid, right? They're not going to care about what the endocrine system looks like. But an ND will look at both the, rheumatologic side of it and the endocrine side of it. And so we will order all of those things because we know that intimately they're connected. And I don't think that that's too much testing. I think it actually narrows it down because you have one provider that's doing a scan of things that's not just parceled out by the different specialties that a lot of conventional medicine has been pigeonholed into. But any provider can order too many labs, sure. But I don't know that that happens.
I actually find myself not ordering enough, maybe because I'm so concerned about because some of these tests are expensive, and especially when you get to like stool testing, and those are like, and I know a lot of providers will upcharge. They'll take a $450 test and charge 600 for it, so they can make a buck on it.
Yeah, that drives me crazy. I fucking hate that.
We made it 9 minutes into the podcast
Yeah,
before.
see, there it is.
Yeah, I do fucking hate that too, and I don't mark up any of my labs, which I think helps build a little bit of trust with the patient. But that's another thing. One of So the autoimmune mentorship I did with you was very valuable, and I think what it showed me, was I still don't know what I don't know. And when it comes right down to it, I've actually sent you a couple patients. I don't know if they've made their way to you, but what I know that when I'm overwhelmed, I need to send them to an expert. Um, but it takes a long time to work through some of these really complex cases. When you think about the different types of things that can create an autoimmune condition, and I'm just going to list a few, and we can talk about these a little bit more. Epstein-Barr, Lyme disease, dysbiosis, and if you follow Gabor Mate, emotional and psychological trauma, and and even with those, it's like, well, there's a whole bunch of testing just to get to, and not that's not even the exogen of eyes, and we can get into that in a little bit. Um, so it's cost and time. How do you work with your patients to work through that in a way that is palatable for somebody that, like, you're a cash-based business and people aren't using insurance? Like, that's a consideration for folks who are working through very complex cases.
Well, yes, I am a cash-based practice, but pretty much all labs that I order are covered by insurance. It depends on the lab, right? So the only cost they have out of pocket is seeing me as a provider. But so all autoimmune diseases, they have both a genetic component and an environmental component. Like the genetic component kind of sets up the pathway for what you might potentially develop over time. And then you've got this environmental component that sort of pushes you down individual pathways. It's like why you can have identical twins and one of them develops rheumatoid arthritis and one of them develops, psoriatic arthritis. Like, why did they not both develop rheumatoid arthritis? Each of them had individual environmental triggers that created separate diseases, even though they basically have the same genetics. Now, in these cases, as an ND, but I also think that conventional providers are starting to do this too, although it's harder because they're in subspecialties. But in order to really treat autoimmune diseases from a very comprehensive perspective, we have to take into consideration the things that have triggered that inflammatory response because the immune system is reactive. It doesn't just do things, it has to do things because it was told to do something. And a lot of the main environmental triggers are often infectious things that you've listed because the immune system's job is to recognize infectious agents. So things like EBV and Borrelia and Lyme disease and certain types of dysbiosis, which is bacterial changes in the gut. And those things, because they're microbial, will cause the immune system to react, which might eventually spur an autoimmune reaction. And so you're looking for those things. And hormones are a big trigger as well, because we know that the endocrine system really does trigger lots of different types of inflammatory reactions on a number of scales. That's been well researched and documented. So we have to look for those triggers. So when you're talking to then about this other bigger picture of ordering labs, like we're ordering labs to check in on the types of conditions a person might be dealing with, but then we're also looking for these triggers. Is it an issue with a bacterial overgrowth? Is it an infection? Is it a change in their hormones? Is it um, something in their diet? Is it something they were exposed to, like molds or metals or something like that? And then that's going to require additional testing. Now, I think I got all the questions you asked, but then your final question is ultimately like, how do we justify doing all those things with a patient, taking into consideration time and money, which I think is extremely important, and I try to do with everyone that I see, is that I usually try to figure out things systematically. So I'm not doing everything all at once. Like I will sit down with someone and we'll go through everything and I'll say, okay, actually, it looks here that probably like your gut is like way off. Like if all these GI symptoms, your bowel movement like patterns are off, let's go down the route of microbial dysbiosis or look for infection. So we'll just do the stool testing this time. Or maybe your hormones are way off. So we're going to do basal body temperature tracking and we're going to try to measure your hormones at a certain time during your cycle. And I try to do them one at a time, mostly one, because that saves on cost. It does prolong things a little bit, but it also gives me a clearer picture often of like what's happening and when, like what has a bigger reaction or a bigger trigger for an individual. Cause you don't know. You just have like a list of things you think might be potential triggers and you have to kind of go down the list and verify.
So that raises the question then, if because that's one of the things I tell folks, we can do this, we can run this test, but if it's one of the autoimmune conditions that doesn't have biological markers, that, this test may come back negative and you still could have autoimmune, which can be very frustrating for the patient because a lot of people want to see some hard science that shows them a diagnosis. Like, what do you do with that percentage of the population that has an autoimmune condition that doesn't show up on any diagnostic study?
Well, that's a huge portion of the population that I see. And most of the conversations that I'm having with people is one, reassuring them that I do believe something is going on, because most of the time there is. And then have that conversation with them about, like, all right, we can't get any hard definitive thing on a piece of paper that says you have this illness, but you check all these boxes. All right. So if we can't use labs or imaging, then we have to go based off of symptom and clinical observation. And if you have all the markers for symptoms and clinical observation, you can make a diagnosis. And it might not feel like a hard set, but that's just what we have to go off of. In my opinion, it doesn't necessarily change the way I'm treating something, especially if I'm working from like a place of identifying and removing and treating the triggers to their inflammation. But it is sometimes helpful to reassure people that, like, yeah, more than 50% of autoimmune diseases don't have markers in labs and imaging. You're part of that population, and you have all of these things that line up. And I would say that you have this diagnosis. And I have people too that come in and be like, "A rheumatologist told me I don't have this." And I'm like, fuck that person. And I'll just like, or I'll call I've had conversations with rheumatologists, endocrinologists, gastroenterologists, and I'll call them up and I'll be like, look, I think that this person has, rheumatoid arthritis, and maybe it's seronegative, and these are the reasons why, and this is the diagnostic criteria, and these are the symptoms that are coming up and what I saw clinically in office. And I've had those specialists change their diagnosis based off of this stuff, because they have 15 minutes to spend with an individual. They don't have an hour like I do. So sometimes I'll do that, and if they're really stubborn and they're kind of assholes, and I'll just be like, "Damn, just we'll find someone else," or screw it, I can just do it what their job is anyway. So
Um, that is one thing that I love about what you do is you are one of the naturopaths that's very comfortable working with conventional medications. I am not. Like if somebody needed methotrexate, like I'm not touching that with a 10-foot pole. I just don't understand it well enough. Uh, uh, how did you get there? Is it just a philosophy thing, or did you find? I mean, some naturopaths are philosophically okay, and I'm okay with things like lisinopril or blood pressure medication. But when we get to some of these heavy hitting medications, it's like, ooh, I don't know about that. So, like, is it a philosophy, or is it something that you learned because you had to?
oh, that's a good question. I mean, my background is in pharmacology, so I always had like a toe in the field of pharmacology. Like I wanted to be a chemist that worked at a pharmaceutical company that made drugs for people. And then I learned about, what pharmaceutical companies do, and I was like, ethically, I'm not cool with most of that. But I think, understand the importance of medications in times of need. And I think a lot of people like to divide conventional and alternative medicine into these like two very distinct areas of practice that they don't have room to mix with each other. And I don't know that I agree with that. So maybe that's the philosophical piece of it. Like I think they work really well together. I don't think that every naturopathic doctor should be anti-medication, and I don't think every conventional doctor should be anti-herbs and supplemental and dietary changes. I think that if we found a way to blend our medicine together, we get the best of both worlds. And we can use medications when necessary. Like if someone comes in and they have, rheumatoid arthritis and they don't want to use medications, I can have that conversation with them to say, well, we should use medications now because you have joint damage, and all of the alternative stuff's going to work, but it's going to take time. And I don't want your joints to be further damaged, but we can use this medication. We can mitigate the side effects of it temporarily and then work to get you off of it while we're implementing all the other stuff that's going to help with the long-term goal. And that in my opinion is like a really beautiful way to use both worlds to help people get as far as they can with all of the options available to them.
I couldn't agree with you anymore. And I do have patients that come in sometimes and they tell me what they're on and what they're doing, and they want to get off of them. And they are surprised when I say, "Well, let's not go crazy. You're on those things for a reason, and it's a step by step process to remove those." And so, giving them a little bit of education on what those things are for and why they're there, and the safe and prudent way to get off them is provides a lot of education. Um, I love how you talk about the overlap between conventional and alternative, and the fact that they're not two disparate things, because that's what this podcast is all about. Like how um, the example I use is I got in a bike accident in 2022, and I didn't want a naturopath looking at me to see if my collapsed lung was going to be fixed by an herb. um, like there's a place for the Western, I guess, philosophy, and there's a place for the alternative lifestyle and other things. And I think that's something that, at least from my perspective, that you've done well in your practice.
Yeah, and I think, I mean, I've seen it work in theory. Like when I was doing my acupuncture training, we went to China and we like worked in the hospitals there for a couple weeks, and I could see people who would like go in and get surgery, and they would come out of surgery and then they would get acupuncture in the hospital. Like, why are we not doing that? That seems so, I mean, we're doing a little bit of that. That happens here in Seattle a little bit, but I don't know. I think it would be great if we could, I don't know, maybe that's like too optimistic of me. We just fucking work together. It seems like the best of both worlds.
I think as our conventional medical system continues to struggle, that it's just going to be organic. That's how people find me. I've tried everything, and I looked at your website, and I figure, what do I have to lose? Let's go for it. Like,
Yeah,
all right, we're
I know. And I mean, doctors are dropping out, I mean, a lot of MDs are dropping out of the medical field like crazy right now. I mean, we have a huge doctor shortage, and a lot of that has to do with just, I mean, how shitty medical system has been to physicians, how they're forcing them to work really hard in short periods of time and try to treat all of these conditions with like really limited resources. And I think they're getting tired of that. Like, physicians don't wanna spend 15 minutes with a patient. Like, they don't wanna have to see 60 people in one day. That's crazy, and people don't wanna be seen in 15 minutes.
I don't know how anything meaningful can happen in 15 minutes. Like, you can hardly take somebody's blood pressure and and their vitals in 15
I
minutes.
yeah.
Like, that's insane.
So, I'm hopeful that it'll change soon.
We'll keep our fingers crossed. Um, one of the things I did in getting ready for this podcast today was we have a WhatsApp group, for the folks who have done Jenny's, autoimmune mentorship, and somebody mentioned the idea that an autoimmune condition isn't an all or nothing thing. And I thought that was a really important point. People manage these things, and they ebb and flow as stress comes and goes or mold exposures happen. And I was curious to know your thoughts on how you couch that with your patients, how you manage the fact that this may not go away entirely, but you can manage this.
Oh, yeah. Well, and this is, the internet loves to tell people who just got newly diagnosed with an autoimmune disease that they're gonna die from it within the next 5 to 10 years. And I'm like, and I have people come into my office, I'm like, "Okay, wait, you gotta, like, the internet's great. It's a wealth of information, but you also have to, like, tailor it in slightly." I know, and not that I believe, I know that people with autoimmune diseases live very healthy and long lives, and I mean, I've been doing this for 15 years, so I can say that at least 15 years of healthy and long lives. And, the way that we think about it is this, like, you'll always have the genetics, but the genetics don't predispose you to developing I mean, it predisposes you to potentially developing the disease, but it doesn't mean that you'll get it. And I think that if you can control your inflammatory triggers, if you can, get your body back into a healthier state where your immune system's not freaking out all of the time, that you can actually be in a space and a place where you feel very healthy and your disease does not control your daily activities, if anything at all. And At the same time, though, you have to note that you have this information now that you have an autoimmune disease. So anytime something comes into your life that might potentially flare your inflammation, then it will flare the autoimmune disease. And that doesn't mean you're never going to get a flare in the future, but our goal is to reduce those triggers and inflammation as much as possible. So when you do get the flare, that it's less severe and it's shorter in duration and it doesn't completely derail you for weeks or months or years on end.
Yeah. And I think it's important, particularly for women, because you mentioned the hormone piece, to understand as early as possible what's going on with their bodies, because as hormones change, I just got my ass kicked by menopause. So
God,
like
yeah, I'm
menopause
getting close.
oh, it's like, menopause in and of itself is a punch to the face, it feels like, and maybe that's just because of my own particular diet and lifestyle issues. But understanding how your body is in establishing care with somebody long term, so they can walk you through these different phases of life as you have children, you're breastfeeding, like that's stress on the body, and then you go through the hormonal changes of menopause, things shift radically. It's good to know that you've got somebody there who can walk you through all these changes as you age.
Absolutely, yeah, and autoimmune diseases are 5 to 10 times more likely to occur in women versus men, and those are people that have higher levels of estrogen or fluctuations of estrogen, and the most common times that people flare are within 3 months postpartum after having a baby and when they go into menopause, and those are because of the fluctuations in the hormones, and a lot of people and a lot of primary care doctors or people don't understand that this happens, and I've seen individuals that have a baby and they come out of it and their like joints are hurting like crazy. And the people will tell them, oh, that's normal. You just had a baby. Of course, your joints are going to hurt. Yeah, sure. Yeah, sure. Okay. There's some of that to a certain degree, but that doesn't mean you should just blow people off because that's quote normal. And also, we don't understand shit about women's health. So, like, the fact that we just like lump it all into this, like, well, yeah, you're going to feel crappy for 2 years after having a baby, or menopause sucks, or perimenopause sucks. And so it's just deal with it. Everyone's different. I think when we have a better knowledge and understanding of how to differentiate between, okay, what is sacral pain due to the laxity of ligaments in relationship to pregnancy versus inflammatory pain that has a very different pain pattern that could be flaring because of increases of prolactin and estrogen and reductions of progesterone postpartum. And if we have better education in those areas and we can differentiate them, then there are so many individuals that won't have to suffer for as long as they have to during those periods of time that aren't pleasant anyway for the quote
Right.
unquote normal population.
You bring up a really good point. The idea of, and for those who are listening on video, I'm air quotes, normal. Like just because, and I have this conversation with people, it seems like every single day, they're like, is this normal? Well, it's normalized, but it's not healthy. And that's a really important point to understand.
Yeah, I am pretty confident that our like determinations of what normal are in our society are so I mean, if you just look at basics like water intake, like people think that it's normal to just drink whatever 8 ounces of water a day. And like that's just like that's dehydration. So like, I think it's fascinating. I think our views of normal are just so skewed.
That's I'm a big fan of Gabor Mate, and The Myth of Normal is one of my favorite books. Um, I- and that's actually a good segue because there's this whole piece of autoimmune that we haven't talked about, and that's the emotional and the psychological. Do you see that? And if you do, how do you work with that?
Yeah, I see it all the time. Like, it's stress and stress responses, and that doesn't have to necessarily be emotional stress, like, it can be mechanical stress or mental stress. It has a huge impact. I mean, if we just look at cortisol, which is the quote unquote stress hormone, but cortisol does a number of things. Fluctuations in cortisol have huge impacts on autoimmune disease. I mean, shit, prednisone is cortisol, right? So it makes sense that fluctuations in cortisol, it would be like putting you and taking you off of a steroid taper over and over again. It would flare an autoimmune disease like crazy. But then also there's lots of evidence of like neuroendocrine changes in stress responses that can trigger certain types of autoimmune diseases. I can't tell you the number of people I have that, like, go to Hawaii and, like, all of a sudden their autoimmune disease is, like, miraculously better. Like, actually, this morning, I had someone in my office who's like, "I was just in Australia for 2 weeks, and I had no pain, no inflammation. As soon as I, like, touched back down, it's like everything came back." And I live in Seattle, so it's, like, cold and dark and here and stressful. And, I think it plays a huge impact on autoimmune diseases and our inflammation as a whole in terms of how our immune system will ramp up or decrease. Yeah, for
Yeah.
sure.
I think another one of the things that we've normalized as a population is what is healthy stress. Because I can't tell you how many patients I have that come in and say, "I'm not stressed out." Oh, really? Tell me about your life. And I actually had somebody who had two full time jobs, so they were working 80 hours a week, and I'm like, how's that working out for you? Um, but, tell me about your life. Well, I'm a shift worker, or I have 3 kids and I'm caring for my dying mother, and my dad has dementia, and my relationship with my husband or whatever, my partner isn't healthy, and but it's all good. I'm doing okay. I'm like, well, you're not doing okay. You're sitting in my office talking to me about all these symptoms, and so helping to normalize what's healthy stress, the stress that helps us grow, as opposed to the stress that breaks down our immune system, our stress response system, adrenal, like all of that is to me, and this is where I excel. Like I'm sending patients to you to go get deeper level management of really complex conditions. But I think what I do well is helping people see where they can make changes in their life and their mental health to affect what's going on with their inflammation.
And I think that stuff is as important as being able to manage things like medications. Like, I have seen really impressive responses. Like, I've seen people who all they did was, like, put their kid into daycare part-time, so they had, like, a little bit of space to themselves, shift an autoimmune disease as much as, like, giving them medication or you know, taking food out of their diet. I mean, they did studies on, fibromyalgia, which we think now might potentially be autoimmune disease, and they found that, like, if a doctor sat in a room with someone with fibromyalgia and just confirmed that they actually felt like there was something wrong with that individual, like confirmed that there was something going on, that it decreased a person's pain with fibromyalgia as much as giving them any of the medication options that you
That
could give them.
that's insane.
Yeah, it's wild that, like, just relieving someone's stress by reassuring them that you're on their team and you believe them is as effective as giving somebody Cymbalta or gabapentin for fibromyalgia.
Crazy. Listen to patients, don't gaslight them. That's just
Yeah,
insane.
yeah,
Uh,
yeah.
let's see. Um, well, that's just a good naturopathic principle, anyways, not to gaslight people. Like, let's try to excel in that. Um, so we talked a lot about women, but half population is men. I'm curious if there's any difference. I didn't write this on the list of things. I'm just like thinking out loud. Is there a difference in the way men present with autoimmune conditions? Is there a way that you treat them differently, or is it pretty much the same without maybe as much of the hormone component?
I think well, no, I think there's often a hormonal component with men who present with autoimmune diseases. They're less likely to develop an autoimmune disease, but they're we always still have to take the hormonal component into consideration, and that's usually a reduction in testosterone. Like, they might have low testosterone or low DHEA or something to that nature, or maybe they're aromatizing and they're producing too much estrogen. Like, that'll happen too. Um, the but I think that well, this is an interesting question. I mean, I think men in general present the same. The disease is the same. They'll have the same or similar symptoms. I don't think that they present the same necessarily because I don't know if this is like cultural or what, but I do think that a lot of men wait until their disease gets really bad before they ask for help. And so, I see it often tends to be more severe or in later stages, usually when I see it. And I don't know what that is other than maybe like a cultural aspect.
I wouldn't be surprised. It's my opinion that women don't die later, they just go to the doctor.
Yeah.
Oh,
I mean, and, most of the men that I see have been sent in because another, female individual in their life has kind of pushed them in the door.
oh goodness. Um, that's a whole nother podcast.
Yeah.
Um,
Potentially, yes.
so I'm thinking we'll probably edit this part out. I remember what I wanted to ask. I didn't write this in there either, but like you and I are both acupuncturists. And when you gave our rheumatology class, it wasn't a lot about Chinese medicine, but there were little tidbits that were thrown in. I'm curious how much that comes into play with your practice, because for me, it's a huge part of my practice. Like you have rheumatoid arthritis, let's get you on the table and see what we can't do with you from the paradigm of traditional Chinese medicine. How does that how does that work for you, and how does that change your game as compared to somebody who's coming from a conventional perspective?
I mean, I love using acupuncture. Acupuncture for pain management has been studied for years. It is what acupuncture is known to do, but it's very effective in terms of not just reducing pain, but also helping to control some of the immune system response. And so the the beautiful thing about acupuncture is that you work from like a really deep constitutional level that you can't always get by like throwing medications and herbs and stuff at people. So I use it quite a bit. It's time consuming, but I do love doing it as with as many people as I can. Yeah, I try to hire more acupuncturists so I can just send them over to to them. So I'm finding my minutes are decreasing too quickly these
You
days.
are you are a very busy person indeed. I spent a day shadowing Jenny back when I was early in my residency, and I was like, "Wow, uh, she has
Can
arrived.
be
I have not."
chaos. Yeah.
What's that?
I say it can be chaos some days, yes.
Oh boy, I love it. So we're getting a little short on time. We've talked a lot about we've talked a lot about autoimmune from like we've used a lot of medical language, but I want to wrap it up with these last few minutes and put it into layman's terms of recommendations for people that think they have autoimmune or do have autoimmune, so that the average person can understand what it is that we're trying to get across.
Yeah, so, I mean, ultimately, like, inflammation, which is basic just presentation of, you know, fluctuations in temperature, like, you get hot or cold, or if you're having pain, especially that's, like, worse when you're not really moving a ton, or any kind of like heat presentations or swelling. Fatigue is a really common, but fatigue is a symptom of lots of different things. I mean, most people who just come in say they feel just kind of off, like they feel a little bit sick, but they're not really getting sick because that's like the immune system kind of starting to flare. And I think if you're just feeling a little bit sick and you're not actually getting sick is a good time to go in and maybe get some stuff checked out. And that can be as simple as getting a few labs run or just having a conversation with someone who is familiar with different types of autoimmune diseases so they know the questions to ask, even if you're not quite sure of the information to give necessarily.
I think one of the messages I have for patients is just because somebody told you that there's nothing wrong with you doesn't mean there's nothing wrong with you.
Yeah, doctors are humans and they get shit wrong all of the time. And like, I think that yeah, I all the you could put 5 rheumatologists into a room with, a seronegative rheumatoid arthritis patient, and they will give all of them will give different diagnoses. Like, just because yeah, just I completely agree with that. Just because someone says there's something wrong with you doesn't necessarily mean there's something wrong with you. So, sometimes just finding the
Well,
right.
once again, healthcare is an art and not a science in my mind, and that doesn't mean that it's not a science. Like art can be science. Anyway, uh,
That's the blending of both worlds. Yeah.
right? Oh my gosh. I love it. So we got about 5 minutes left. Any thoughts that you have that you'd like to share before we end the conversation today?
Yeah, I always encourage people to trust themselves, to trust their ability to know what's going on with their body, to and then to find people, especially healthcare, is a team effort. So you need to find people that will work with you and be part of your team, not work against you. And if you're not finding those people, then find somebody else if you can. There are lots of options out there, even though it feels like the options are dwindling. There are still lots of options.
Well, one of the things I live over in Port Townsend. I'm over on the Olympic Peninsula.
I know, I'm so
And
jealous.
right. There's a lot of good reasons to be out here. But I have found that the providers here are very open to all. We have a bunch of naturopaths that work out here, and they're starting to recommend. I hear of conventional providers recommending, one of the NDs down the road and recommending me. But I've heard of one of the rheumatologists that they have on staff now at Jefferson Healthcare is actually in Montana and does telemedicine for folks that have rheumatological conditions here in Port Townsend. And I hear she's awesome. And so it's like having a tool in my toolkit. Well, if you're not gonna see Jenny Bird in Seattle and you need to use insurance, you can at least go to Jefferson Healthcare and ask specifically for this woman who is looking to treat things not just from medication, but from like an alternative. I think she's a DO.
Yeah, I mean, I think COVID really opened up a lot of telemedicine options for people, which I think is one of the benefits, one of the few benefits that came out of COVID. But I think that there are so many more options now in terms of being able to just meet with people who might be able to offer additional resources or second opinions or give you information about things you should be getting, and then you can always go to local providers to get those necessary things.
I think my takeaway from this whole conversation is to, first of all, trust your body. Like you're not. How many times do I say that? You're not crazy. I swear, I believe you that there's something going wrong, and to not give up. I don't talk directly to the providers or to here, but I get their notes and I make sure that anything that I do is working in conjunction with them for any kind of care that folks get. And I agree that it works really well that way. I do a lot of education on when I get their chart notes from other providers here from Jefferson Healthcare to explain this is what this is and this is what this is. And that in and of itself, I think reduces people's stress, understanding what it is the treatment plan was and why they're doing it. And like, oh, okay. All right. So we're almost out of time. Jenny, thank you so much. For those of you who are
Great.
listening, yeah, listening instead of watching, you might want to get the YouTube because the background in Jenny's office, I always love seeing it. Yeah, you might want to just tune in just to check it out.
The
Um,
I
and do you
mostly
have?
do this to target the haters on TikTok.
Oh my gosh. And is that a uterus on your earrings? Is it, what am I
This is
seeing
a
on?
uterus that is giving the middle finger, yes, with the fallopian tube.
Oh my fucking God. I love it.
Yeah.
All right. So, if somebody wants to find you, how do they do that?
Yeah, I am lots of places. I am on all the social medias, much to my dismay. On TikTok at Dr. Jenny Bennett, on Instagram also at Dr. Jenny Bennett, but also my clinic, which is Aria Integrative Medicine in Seattle, has all of the social media stuff. I'm here also at Aria Integrative Medicine in Seattle, which you can always contact our office if you have questions for me. And yeah, those are the main places. You could just also come by and say hi.
All right. All right. And if you're in Port Townsend and you're looking for healthcare, come look me up, meridianpassagewellness.com. I'm also on all the social medias, much to my chagrin. I have to. Dr. Kristin Barnes on Instagram, Alternative Flight Plan, Meridian Passage, both have Facebook pages. And if you're in the state of Washington, I do telemedicine as well. So don't be afraid to take a look at my website. I focus mostly on chronic pain and physical modality of counterstrain. And there's lots of information on my website about that. But if you just want to talk about autoimmune conditions or strange pains, give me a call and we'll start unpacking that for you. So thank you, Jenny. I really appreciate it. I'm a big fan, and I admire the work that you're doing because not a lot of naturopaths are doing it the way you're doing it. So thank you very much. Thank you for teaching it. And
Thank you. I love this. Thank you for having me.
You're welcome. Thanks for being on the show. All right, with that, we're going to wrap it up. As we say in Navy speak, we're going to bring it into the pattern and bring it back down to the aircraft carrier for an OK3 wire and a burger at Mid-Rats. Jenny probably has no idea what that means. That's okay. Bringing in the naval aviation speak. All right. Thanks for listening. And if you like what you heard, please like, share, and subscribe. And the most important part of that is share. So thanks very much for tuning in to the Alternative Flight Plan, and we'll see you on the next episode.